Hello everyone, my name is Tryon. We're here to cover session 2 of Provide Recovery Oriented Mental Health Services, unit number CHCMHS003. Before we start, I just want to acknowledge the traditional owners of the land. In the spirit of reconciliation, Hattah Institute of Education acknowledges the traditional custodians of country throughout Australia and their connection to land, sea, and community. We recognise Aboriginal and Torres Strait Islander people as the first inhabitants of this nation and the traditional custodians of the land on which we work, live, and study. We express our gratitude for the sharing of this land, our sorrow for the personal, spiritual, and cultural cost of that sharing, and hope that we may move forward together in harmony and in the spirit of healing. We pay our respects to all First Nations people and acknowledge elders past, present, and emerging. Okay, now let's just go over the overview of this session. So, as you can see, the first two core units, the two core areas that we'll be covering today is the wellness plan and collaboration. So both of these elements are foundational to providing recovery-oriented mental health services, and they're deeply interconnected in practice. So let's break them down quickly. So when it comes to the wellness plan, it's important that we, as professionals, will focus on this area. These are structured, personalized plans that provide a roadmap for recovery. They help individuals set meaningful goals, identify their strengths, and address any barriers that might arise along the way. So during today's session, and we did touch on this last week, we'll be looking at what goes into a wellness plan, including identifying an individual's unique needs, goals, and their aspirations. Strategies to encourage individuals to take an active role in developing and managing their plans. We'll be looking at the practical steps for implementing these plans in a real life scenario, ensuring they're flexible and responsive to changes. Um, we'll look at how these plans are not just documents, but dynamic tools that empower individuals to take control of their journey towards recovery. A well-designed wellness plan helps individuals stay on track while also fostering their independence, resilience, and hope. Next, we'll look into the topic of collaboration. So providing recovery-oriented mental health services is not something that can or should be done in isolation. Collaboration is about creating strong, respectful partnerships with everyone involved in the recovery process. This includes the individuals themselves, of course, their families, caregivers, and other professionals such as doctors, counselors, and community support workers. We'll also discuss how to work collaboratively with individuals to ensure their voice is central to the process. We'll look at the value of building partnerships with families and support networks to strengthen the recovery framework. We'll also look at the importance of interprofessional teamwork to deliver holistic and effective services. Collaboration also means recognizing and respecting the diverse cultural, social, and personal context of the people we work with. By the end of today's session, I hope that you'll have a better understanding, or you'll be better equipped to bring together different perspectives, strengths, and resources to create truly integrated approaches to recovery. Communication. So communication plays a crucial role in supporting individuals throughout their recovery journey. There are two key techniques that I want to mention. The first one is active listening and normalizing statements. So these techniques are essential tools for building trust, fostering understanding, and ensuring that the individual we work with feel heard and respected. Let's start with active listening. So this technique goes beyond simply hearing someone's words. It's about fully engaging in what they're saying. Active listening involves maintaining eye contact to show you're present, using verbal cues, sorry, like I understand or tell me more, to encourage them to continue sharing. Reflecting on what they've said by paraphrasing or summarizing key points to confirm understanding. When you practice active listening, you demonstrate that you value the individual's thoughts and their feelings, which is especially important in recovery-oriented environments. It also helps you better understand the individual's experience, their needs, and their goals, allowing you to provide more effective support. The second technique is on the screen is normalizing statements. So these are statements that help individuals feel less isolated or ashamed about their feelings or experiences. For example, if someone shares their feeling of being anxious, you might say, that's completely natural to feel this way, given what you're going through. Or if someone is struggling to open up, you could reassure them with something like, many people find it difficult to talk about this at the first time you have your session. So by using normalizing statements, you validate their experiences and reduce feelings of stigma or self-doubt. It helps create safe space where they feel more comfortable sharing and exploring their thoughts and emotions. Both active listening and normalized statements are foundational to effective communication, especially in recovery-oriented practice. They build rapport and trust between you and the client. They encourage open and honest dialogue. They also create an environment where individuals feel supported, understood, and empowered to take steps towards their goals. Now, as we move forward, we'll look deeper into each technique and practice applying them through some examples and role play activities, or case study activities during our live sessions. So take a moment to reflect on how you've used these techniques in the past in your own interactions. Think about what's worked well, and what could you improve on. Um, and we might talk about that during our live sessions. Okay, I've so like all presentations, there are certain videos or certain links to videos that we cannot play during our recorded sessions. But as always, these links will be sent to you guys in an email for you guys to watch in your own time. Again, we highly recommend that you do watch these videos, as it will give further knowledge and understanding of the unit. Okay, so to continue on with communication techniques, effective communication is the cornerstone of supporting recovery-oriented mental health services. Now, here I want to go through two more techniques that can enhance our interactions with individuals: reframing and oars. So these techniques help us foster positive, productive, and meaningful conversations, especially challenging situations. So let's start with reframing. Reframing is about shifting the way someone views a situation, challenge, or experience. It's not about denying the perspective, but offering a different way of interpreting it. So one that is more empowering or solution focused. For example, if an individual says that I failed at everything, you could reframe this by saying you faced a lot of challenges, but each one has helped you learn and grow. Let's look at what you've achieved along the way. Or if someone shares, I'll never be able to manage this, you might say, as a reframing technique, that this feels overwhelming right now, but you've shown resilience in the past. Let's break it into smaller, more manageable steps together. Reframing is a powerful tool because it helps individuals see possibilities rather than the barriers, instilling a sense of hope and motivation to move forward. So next we have OARS, which stands for open-ended questions. The A stands for affirmations. The R stands for reflective listening, and S is summary statements. So OARS is a core technique used in motivational interviewing, a collaboration style of communication designed to strengthen an individual's motivation and for change. So let's start with open-ended questions. So these encourage individuals to share more about their thoughts and feelings. Affirmations, this is about recognizing and reinforcing the individual's strengths or efforts. For example, you could say something like, it's great that you've been open about your feelings, and sharing takes courage. The next one is reflective listening, and this is about paraphrasing or summarizing what the individual has shared to ensure understanding. And summary statements. So this is when we are wrapping up the conversation by highlighting key points and next steps. This technique fosters trust and collaboration, which will allow individuals to feel supported and understood as they work towards their goals. Both reframing and OARS are essential tools for navigating conversations that can be emotionally charged or challenging. They shift conversations from negative to possibility. They also encourage individuals to feel seen, heard, and valued. And they also help build a collaboration environment that is focused on growth and recovery. Okay, all right, let's keep going with communication techniques. So effective communication involves more than just words. It requires us to be fully present and engage with the person we are supporting. Now, the three key techniques on the screen are vital for meaningful and supportive interactions: attending behavior, paraphrasing, and encouraging. We spoke a little bit about um, paraphrasing as part of OARS, but we'll go for a little bit more in this slide as well. So attentive behavior, let's start with attentive behavior. So this is all about being physically and mentally present when engaging with someone. So it involves using verbal and non-verbal cues to show the individual that you are fully focused on them and what they are sharing. Some of the key aspects of attending behavior is eye contact, body language, and minimal verbal encourages. So this is about using brief phrases like "I see," "Go on." Um, Paraphrasing. So paraphrasing is a technique used to ensure mutual understanding and demonstrate that you have heard the individual clearly. It involves restating what the person has shared in your own words, focusing on the core message. Another example of reframing is if someone says, "I feel like I'm always struggling and getting nowhere," you might paraphrase that by saying, "It sounds like you're feeling stuck and frustrated with your progress." Now, paraphrasing has several purposes. It shows that you are actively listening and you are making an effort. It allows the individuals to clarify or expand on their thoughts. And it also helps to reinforce trust and rapport by showing genuine interest in their experience. The last one there on the screen is encouraging. Encouraging involves using positive reinforcement to motivate and uplift the individual. This could be as simple as acknowledging their efforts or pointing out their strengths. For example, "It's great that you're sharing this. It takes a lot of courage." Or, "You've shown incredible resilience by continuing to work through these challenges." Encouragement helps individuals feel valued and supported, which can boost their confidence and willingness to engage in the recovery process. It's about highlighting progress, no matter how small, and reminding them that they are not alone. Okay, let's have a look at basic counseling skills in a practical setting. So this slide introduces the concept of role plays as a learning tool where we practice these essential skills in a safe and supportive environment. Role plays are an excellent way to observe, reflect, and refine our techniques. They are important because they allow us to practice in a safe environment. So it gives us the opportunity to try out different approaches without the pressure of real life situation. It allows us to gain insights by stepping into different roles. Then we can better understand the perspectives of both the counselor and the individual seeking support. It allows us to build confidence as well, receive constructive feedback as well after role plays. Um, in the upcoming role play sessions that you'll have, or the information session, you'll have opportunity to ask questions about the basic techniques that are required when applying role plays for your assessments. But these role plays that we do during our assessment, it's not just about passing assessments or completing an assessment to pass the unit. It's about learning key techniques to better enhance yourself to better apply yourself as a counselor or a professional in working in mental health, in the mental health field. You learn to refine your skills in terms of active listening, paraphrasing, summarizing, and encouraging statements. So it's very important when you are doing these role plays, you use it for that reason to improve your ability in client interactions. Okay, developing and documenting plans. Developing and documenting plans is very important aspect of career-oriented mental health services. This process allows us to create a clear and structured path for individuals tailored to their unique needs, goals, and circumstances. On this slide, we'll focus on three critical elements: personal wellness, recovery, and implementation, monitoring, and review. Let's explore these components in a more detailed uh, way. So let's start with personal wellness. So this is a foundation of any recovery plan. It encompasses the individual's physical, emotional, social, mental well-being. When developing a plan, we need to focus on identifying the individual's strengths and resources, the challenges or barriers they are currently facing, goals that support a balanced and fulfilling life. Recovery. So recovery is not just about addressing symptoms, but it's about empowering individuals to lead meaningful lives despite their challenges. A recovery plan highlights the individual's aspirations and what they consider important for their personal growth. It also highlights steps to overcome specific obstacles, such as addressing trauma, managing symptoms, or finding employment. It helps you with identifying tools and resources that foster independence and resilience. So in this stage, we aim to help the individuals move from surviving to thriving by focusing on their long-term vision for recovery. Finally, a well-documented plan is only effective if it's actively implemented, regularly monitored, and periodically reviewed in a more thorough manner. So this ensures the plan remains relevant and responsive to the individual's evolving needs. Some key steps include implementation. So this is about breaking down goals into actionable steps, monitoring, so keeping track of progress, review, so revisiting the plan to make adjustments based on the individual's progress, feedback, or any changing circumstance. Developing and documenting plans ensure that services are person-centered, collaborative, and structured. So providing clear and measurable pathway for recovery is very important. Um, by doing this, you will have the opportunity to practice and create plans to incorporate these elements. Okay. As we continue exploring the process of developing and documenting plans, we'll continue to focus on specifically and widely recognized frameworks such as the Wellness Recovery Action Plan, which we covered last week. And I did speak about this last week, where there are 4 video links, a four-part interview, 4-part series that involves the RAP. So I encourage you guys to watch that as well. The Wellness Recovery Action Plan RAP is a personalized approach to wellness and recovery that empowers individuals to take control of their journey. Let's talk a little bit more about this, about RAP as is and how we'll explore over today's session and also the live session. So RAP, or the Wellness Recovery Plan, Action Plan, sorry, is a structured evidence-based tool designed to help individuals identify personal triggers and stresses. Two, develop practical strategies to manage challenges. And three, create a comprehensive plan for maintaining wellness and recovery. What makes RAP unique is it focuses on individual strengths, goals, and preferences. It is entirely person-centered, meaning the individual is in the driver's seat, supported by their network of care. So during these 2 weeks where we've been covering this unit, you will see that we've been taking a step-by-step approach to understanding and implementing RAP. So last week and this week, we were looking at different sections of RAP for our framework. This included learning about the foundational components of RAP, exploring real-world examples of how RAP can be tailored to diverse needs and circumstances, hearing from participants by watching the videos, them links that were provided to you guys. So as we've been working and learning about RAP, you'll see the focus is on wellness tools, daily maintenance plans, crisis planning, post-crisis planning. RAP is more than just a plan. It's a mindset. It fosters empowerment, self-determination, and hope. It's trauma informed. So by focusing on what works for each person, RAP helps individuals build resilience, enhance their self-awareness, and takes control of their wellness journey. It's a practical tool that aligns perfectly with the principles of recovery-oriented practice. This is the episode 3 of the RAP series. Managing risk is an essential component of recovery-oriented mental health practice. Risk plans are tools designed to help individuals and their support networks identify and address potential challenges that could disrupt their wellness or recovery journey. Now, here it outlines 4 key aspects of creating effective risk plans: assessing risks, identifying triggers, marking relapse, and seeking help. So assessing risk is the first step in creating a risk plan. It involves identifying potential challenges or situations that could lead to harm or setbacks in an individual's recovery. Open communication to identify any concerns or fears they may have, collaboration with other professionals and support networks to gather more insight. The next one is identifying triggers. So triggers are specific situations, events, or experiences that may lead to emotional distress or risky behavior. Identifying these triggers is critical to helping individuals maintain stability. So some common examples could be conflicts in relationships, financial stresses, exposure to certain environments or substances. Once triggers are identified, we can then work with individuals to develop the strategies for managing or avoiding these triggers. The next one is marking relapse. So relapse or relapses, whether emotional or behavioral, can be a normal part of the recovery process. Marking or recognizing relapse is not about assigning blame, but about understanding patterns and learning from setbacks. And now these involve documenting what led to the relapse, reflecting on the individual's response and its outcomes, identifying steps to move forward and regain stability. By normalizing relapse as opportunities for growth, we empower individuals to view challenges as part of their journey rather than as a failure. The last part there is seeking help. So a strong risk plan emphasizes the importance of seeking help when needed. And they include things like creating a clear list of people or services that they can contact, ensuring they have access to the crisis lines, phone numbers, mental health professionals, Practicing when and how to ask for help. Encouraging individuals to seek help proactively rather than reactively can make a significant difference in how they navigate challenges. Okay, level of risk. So when working with individuals on their recovery journey, assessing the level of risk is an essential part of this process. Now, here I want to introduce three key aspects to consider when evaluating and managing risk: potential risks, potential benefits, and how risk can be reduced. By addressing these components, we can create a balanced, proactive approach that supports individuals' goals while ensuring safety and wellness or well-being. First, we need to identify and assess potential risks. So this could include emotional or physical harm, situations that might lead to setbacks in recovery, challenges in maintaining stability. So when evaluating risks, it's important to take a collaborative approach by involving the individual and, where appropriate, their support network. It's equally important to consider the potential benefits of any action or decision. So recovery is often about taking calculated risks to achieve personal growth and independence. For example, a new job might bring financial stability and a sense of accomplishment, but could also introduce stress. So by evaluating both risks and benefits side by side, we can help individuals make informed decisions that align with their goals and values. Encouraging individuals to weigh the potential positives can instill hope and motivation. Finally, the focus shifts to strategies for reducing risk while maximizing benefits. Involves creating clear, actionable plans that include developing coping mechanisms and resilience building techniques, identifying supportive resources such as trusted friends and family, and also professionals, preparing contingency plans for managing setbacks or unexpected challenges. For example, if someone is considered or considering taking on a new role that may be stressful, strategies could include setting boundaries, participating in mindfulness or practicing mindfulness, or scheduling regular check-ins with their support networks. Balancing risk and benefits helps individuals build confidence while maintaining a safety net to support them through their journey. It also fosters empowerment by involving them in decision-making processes and reinforcing their ability to navigate challenges. When working with individuals on recovery-oriented plans, identifying clear timeliness is an essential part of the process. Timeliness provides structure and focus. It helps individuals visualize their progress and stay motivated. On your screen, you can see four key elements to consider when setting timelines: clear actions, steps, empowerment, and timetables. So let's break these down further. So the first section there is clear. So timelines need to be clear and specific. There's no room for any guessing games, as these can then lead to confusion or inaction. It's important to outline objectives in a way that is easily understood. Next is action steps. So breaking goals into manageable actionable steps is very important. Large goals can feel overwhelming, so smaller, more actionable steps make them more achievable. For example, a long-term goal like securing a stable job can be broken down into steps such as create a resume, apply for 3 jobs per week, and so on. And then we have empowerment. So timelines are not just about structure, they're also about empowerment. So by setting achievable goals and timelines, individuals gain a sense of control over their recovery journey. Finally, a well-structured timetable will help keep everything on track. So timetables provide a visual representation of the timeline, showing when each action should occur. Okay, so session 3 and 4 is covered during this week. So we're up to session 4, so the last part of this session. So here we'll be looking at three main areas, so which is facilitating support, support responses, and reviewing effectiveness. So facilitating support involves creating opportunities for individuals to access the help that they require from a variety of sources that include professional services, informed networks, and community resources. The next one is supporting responses. This focuses on how we as professionals respond to the unique needs and circumstances of the individuals that we work with. And then we'll look at the importance of reviewing effectiveness, regular evaluating the impact of support strategies, ensure things like goals are being met on time, progress is being made, any barriers or setbacks are identified and addressed promptly. So together, these three areas, facilitating support, responding effectively, and reviewing outcomes, create a comprehensive approach to recovery-oriented care. They emphasize collaboration, adaptability, and continuous improvement. Supporting and meeting the needs of individuals in recovery requires a thoughtful and comprehensive approach. Now, here it outlines three essential elements to consider when designing and delivering support: holistic care, aging capacity, and level of involvement. Now, when it comes to holistic, meeting needs holistically means considering the individual as a whole rather than focusing solely on one aspect of their life. This involves addressing the physical needs, emotional, mental well-being, social connections, cultural or spiritual dimensions as well. Then we have age and capacity. So support must also be tailored to an individual's age and capacity. It should involve understanding developmental stages, recognizing individuals' capacity for self-determination, offering age-appropriate tools and language. For instance, a young person might need simple explanation, more direct guidance, whereas a teenager or adult may prefer to take more active role in decision making. The level of involvement refers to how engagement or how engaged an individual is in the recovery process and the decisions affecting their lives. To meet needs effectively, we need to encourage active participation, balance professional input with individual preferences, adapt our level of involvement based on their readiness and comfort. This will empower individuals and reinforce their autonomy, which is key to building resilience and self-efficacy. Okay. Okay, so the first challenge involves in addressing barriers that may hinder an individual's progress. These barriers could include things like practical obstacles, such as lack of transportation, uh, emotional or psychological barriers like fear, systematic issues such as difficulty navigating services. Overcoming these challenges require so overcoming these challenges require engaging open, empathetic conversations to uncover hidden barriers, collaborating with individuals to develop creative and practical solutions. Supporting individuals during a crisis situation is another critical challenge. So crisis can take many forms, including emotional distress or mental health episodes, external events like loss, trauma or sudden life changes, behavioral challenges such as self-harm or substance use. To navigate these situations, it's essential to stay calm and composed, providing a sense of stability, use crisis intervention strategies such as de-escalation. And also adhering to procedures can sometimes feel like a challenge, especially when balancing organizational requirements with individual care. So procedures might include documentation of interactions, plans and progress, compliance with legal and ethical standards such as confidentiality and mandatory reporting. These challenges, addressing barriers, responding to crisis, and adhering to procedures, are an inherent part of our work. However, they also provide opportunities for growth, learning, and collaboration. By approaching these challenges with empathy, creativity, and also professionalism, we can turn obstacles into stepping stones for success. Okay, again, wrap. So I won't cover this part. We've covered it enough during the first part of this session, also last week's session. This is episode 4, so the last episode of wrap. It goes for about roughly 20 to 30 minutes each episode. Preventing recurring challenges is a vital part of supporting individuals on their recovery journey. This slide highlights 4 key approaches to addressing this. Now, the first one is immediate needs. So the first step in preventing recurring challenges is addressing an individual's immediate need. These might include things like ensuring safety and stability, providing emotional support, connecting individuals with urgent resources like healthcare. Meeting immediate needs create foundation for recovery and reduce the likelihood of setbacks. Recovery is not a straight path, and plans need to evolve as circumstances change. So review and adjusting plan ensures that it remains relevant and effective. These will involve things like reflecting on the work, gathering feedback from individuals, updating goals and strategies. The next one is identifying success. So recognizing and celebrating success is crucial for maintaining motivation and confidence. Success doesn't have to be large or dramatic. It can be as simple as attending a therapy session, reaching out to support groups for the first time, or managing stress in a healthier way than before. Lastly, developing a positive view of challenges can transform setbacks into opportunities for growth. So this mindset shifts involves viewing challenges as a normal part of recovery, encouraging reflection on what can be learned, supporting individuals in developing problem-solving skills. By framing challenges as learning experiences, we foster resilience and reduce feelings of defeat when difficulties arise. Responding to individuals in a timely, positive, and supportive manner is a critical aspect to building trust and fostering effective recovery-oriented care. This slide highlights 4 key aspects that guide our response: the boundaries, referral procedures, legal responsibilities, and ethical responsibilities. Now, establishing and maintaining professional boundaries is essential to ensure safe and effective support. They help create clear distinctions between personal and professional roles, build trust by providing consistency, protect both the individual and the professional. Sometimes the best way to support an individual is by connecting them with additional resources and expertise. So referral procedures. These involve recognizing when individuals needs exceed your role expertise, providing accurate and timely information, assisting the individual in accessing these services. As professionals, we have specific legal responsibilities that guide our work, and these include ensuring confidentiality while adhering to mandatory reporting, maintaining accurate documentation of interactions, acting within the scope of our role. In addition to legal obligations, ethical responsibilities play a significant role in guiding our responses as well. And these will involve acting with honesty and integrity, avoiding conflict of interest, advocating for individuals' best interest. Ethical responses ensure that our actions align with the values of dignity, fairness, and empowerment. Responding to individuals in a supportive and timely manner is critical to building trust and ensure effective outcomes. Here I want to outline 4 key principles that guide our approach: remaining positive, being non-judgmental, staying objective, and focusing on the solution. Now, a positive mindset is a um, foundational, point. to providing effective support. Remaining positive doesn't mean ignoring challenges. Rather, it's about offering encouragement, highlighting strengths and progress, maintaining hope and belief in the individual's capacity, positively fostering trust, motivation, and resilience. Being non-judgmental is essential for creating safe and supportive spaces. This involves listening without preconceived notion, validating the individual's feelings and experience, avoiding language or behaviors that may unintentionally shame or blame. A non-judgmental approach ensures that individuals feel respected and understood. Remaining objective means approaching situations with fairness and in a neutral way. This can be challenging in emotional charged scenarios, but it is important to focus on the facts, separate personal feelings or opinions, provide balanced feedback and support. Objectivity helps ensures that our responses are thoughtful, effective, and aligned with individual goals. Lastly, a solution-focused approach emphasizes actions and progresses, and these will involve collaboration, breaking down larger challenges into measurable goals, exploring resources and strategies that align with their needs. By focusing on solutions, we help individuals move from feeling stuck to taking more meaningful steps forward. Managing aggressive situations can be challenging as well, but with the right approach, it is possible to diffuse tension and prevent escalation. I want to outline 3 key strategies to handle aggression effectively: remaining calm, avoiding insults or challenges, and calling for help if needed. So the first and most critical step is diffusing aggression, is to remain calm. Your demeanor sets the tone for interaction, and staying composed helps. Things like reducing tension, communicating that you are in control of the situation, providing a sense of stability. Some practical techniques to remain calm would include breathing deeply, taking deep breaths, speaking in a steady or measured tone, maintaining relaxed body language to avoid appearing confrontational. Engaging in confrontational behavior can escalate aggression, so it is important to avoid using languages or tones that could be perceived as dismissive. Refrain from arguing or criticizing or challenging. Instead, focus on validating their feelings and redirecting the energy towards finding a solution. Sometimes managing aggression requires additional support. So if the individual is not responding to your efforts to diffuse the situation, it may be necessary to involve a trusted family member or friend or another worker. Ensure that the person remains calm and neutral. If the situation becomes unsafe, escalate to appropriate professionals or emergency services. Diffusing aggression requires a combination of self-awareness, empathy, and effective communication. While remaining calm, avoiding confrontation, you'll be able to avoid confrontation. And knowing when to speak or seek help, we can create a safe environment and guide the individual towards a more constructive resolution. Regular reviewing of strategies is an important part of ensuring that the support provider remains effective and aligned with the individual's goals. Now, there's 4 key methods for reviewing strategies: case notes, discussion with the person, engagement with the care network, and observations. So case notes are a valuable tool for tracking progress and identifying areas for improvement. By reviewing case notes, we can monitor changes in behavior, needs, and circumstance, assess whether specific strategies or interventions have been effective, identifying patterns or trends. Accurately and detailed documentation is very important to make informed decisions, ensuring continuity of care across different professionals or team members. The person receiving support is the most important source of feedback. So engaging in open, honest feedback allows us to understand the perspective, involve them in decision-making, build trust and collaboration as well. The individual's care network, such as family, friends, and other professionals, can provide additional insight. This network can share observations or concerns with us, offer support or suggestions, help ensure that everyone involved is working towards the same goal. Direct observation is another effective method for reviewing strategies, and this will involve monitoring the individual's behavior interactions, assessing how they respond to specific interactions or approaches, identifying non-verbal cues or subtle changes that may indicate progress or challenges. Recovery support plans are not static. They must evolve to remain effective and practical. Now, I want to highlight three common reasons why a plan might need adjustment. Sometimes a plan can become overcomplicated, so making them difficult to follow or implement. This complex element might stem from including too many steps or unrealistic expectations, lack of clarity, over-reliance on multiple resources. When a plan is too complex, individuals may feel overwhelmed or discouraged. To simplify it, we need to break the plan down, focus on one or two key priorities, use clear and straightforward languages to ensure understanding. Now, the logistical challenges can also make a plan impractical. These might include transportation issues, scheduling conflicts that prevent consistent implementation, lack of availability of necessary services or support. To address these issues or difficulties, we need to work with individuals to identify alternative solutions, adjust the schedule, explore community resources and supports. Cost is another common reason plans need to be adjusted. These could involve financial barriers, such as fees or services, hidden costs, identifying low-cost or free alternatives. Could be a way to overcome this. Another way could be exploring financial assistance, adjusting the plan to focus on cost-effective strategies that still achieve the desired outcome. Access to the right programs, services, and supports can make a significant difference in an individual's recovery journey. Here, I want to highlight three key areas of support that can be integrated into a recovery plan. Hospital services, the first one, is the cornerstone of professional care for individuals experiencing mental health challenges. These services include inpatient programs, outpatient services such as therapy sessions, crisis interventions, and emergency care for acute situations. The next one is support groups. Now, these support groups offer a safe and understanding space for individuals to connect with others facing similar challenges. These groups provide peer support through shared experience, opportunities to learn coping strategies, provides a sense of belonging and reducing feelings of isolation. The last one I want to mention is complementary therapies. Now, these therapies are a growing area of support that focus on holistic well-being. They include mindfulness and meditation, art or music therapy, physical activities like yoga or Tai Chi. While not a replacement for clinical care, complementary therapies can enhance recovery by addressing emotional, physical, spiritual well-being. Reflective practice is a critical component. Is a critical component start again. So reflective practice is a critical component of professional development, allowing us to continuously grow and improve in our roles. On your screen are four key aspects of reflective practice. Let's go through each one. So seeking feedback. So feedback from others will provide valuable insight into our strengths and areas for improvement. They can involve regular discussions with colleagues, supervisors, and mentors, inviting constructive feedback, using formal tools such as performance reviews or peer evaluations. By seeking feedback, we gain perspective that help us refine our skills and better align our practice. Self-reflection is an internal process of examining your actions, decisions, and outcomes. It involves asking questions such as what went well in the situation and why, what could we have done differently to achieve a better outcome, how did my personal bias or assumptions influence my actions. Next is monitoring and coaching. So this involves actively engaging in your own or others' professional development. And this will include observing your practice to identify patterns, collaborating with a coach or mentor, providing coaching to peers, or team members. Through monitoring and coaching, we create a supportive environment where everyone is encouraged to grow and improve. And legislative changes. So remaining informed about legislative and policy changes is very important for ensuring compliance and adapting practices to meet new requirements. This will involve staying up to date on laws and regulations relevant to your field, reflecting on how these changes impact your role and individuals you support, adjusting your practices align with updated standards as well. So reflective practice is an ongoing journey of learning, self-awareness, and adaptation. Ensures that we remain effective, ethical, and aligned with the evolving needs of those that we support. By embracing these four aspects, seeking feedback, self-reflection, monitoring, and coaching, and staying informed about legislative changes, we foster a culture of growth and excellence. Okay. All right, so that's the end of our session today. We looked at so we looked at a bit more into developing and documenting plans like RAP. We looked at risk plans, so key areas including assessing risk, identifying triggers, and so on. Levels of risk, so evaluating potential risks, and the benefits of actions and decisions. Identifying timelines, so clear timelines, including action steps, and so on. Supporting and mentor and meeting needs. So we looked at the holistic approach that considers the individual's age, capacity, and involvement. Challenges, addressing barriers, supporting during crisis, and adhering to procedures. Responding promptly, positively, supportively. Diffusing aggression, so techniques including remaining calm, avoiding insults or challenges. Reviewing strategies. We looked at reasons for adjusting the plan. We looked at program services and support. So key resources include things like hospital services, support groups, and complementary therapies. We touched on reflective practice as well. So this was this is the end of the session. It's the last session for this unit. If you got any questions or you need any clarification over any topic or anything that we've covered, please contact SLO or you can email me directly as well, and I'll be more than happy to help. So this is the end of our session. I hope you guys all enjoyed, and I'll see you in the next session. Thank you.